Hey guys, Curtis Alexander, I'm a pharmacist. In this video, I'm going to talk about using Uva Ursi to treat urinary tract infections or UTIs. I'll go over the evidence, talk about dosing, side effects, and then at the end, just kind of give you my overall take on whether it's worth a shot. So let's hop right into it. So Uva Ursi has been used by North American Indians for a long time for kidney related diseases, UTIs. So it does have a long history of use in that regards. And the active ingredient we believe that's in Uva Ursi is called arbutin. And you're going to see, if you look at a bottle of Uva Ursi, you're going to see the arbutin content in that. It's going to show you what it is. Usually it's a standardized extract. I'll talk about that more in a bit. Now, there's a couple things to point out. Primarily women, some women have problems with continual urinary tract infections, so we're going to look at prevention versus treatment. Now, I can say right off the bat, as far as preventing UTIs, Uva Ursi does not have good evidence. I don't think it's worthwhile. I wouldn't even probably look into it if you're looking to prevent UTIs. But let's talk about treating UTIs. If you have one come on, is it worthwhile? So there's a few studies. The first one took females with uncomplicated UTIs, meaning there's no blockages. It's kind of a simple UTI. And what they found is that they gave those women 210 milligrams of the arbutin, that active ingredient we were talking about. They did that 3 times a day for 5 days, and then at the end of that, they compared it to the other gals who got a dose of an antibiotic and looked at the results. And what they found is that while the Uva Ursi did help, it did not help as much as a loading dose of this antibiotic, which I will point out is not an antibiotic you're going to see a lot for UTI. So I don't necessarily think it was a fair comparison per se, but they both helped. The antibiotic helped more. So as far as symptom improvement, 49% of the Uva Ursi saw symptom improvement versus 65% for the antibiotic. And at the 5-day mark, they did have to give both of these groups antibiotic rescue therapy. And so 44% of the Uva Ursi group had to get an antibiotic rescue treatment versus 23% who originally got the antibiotic. They also had to get another dose of antibiotic to get symptom relief. So with that being said, like I said, I don't think it was a fair comparison with the antibiotic they used. However, there was some improvement, but just not as good as the antibiotic. Another study looked at using 1,200 milligrams of the Uva Ursi 3 times a day for 3 to 5 days. That particular study did not show improvement of symptoms versus placebo, so that was kind of interesting. Another study looked at Uva Ursi, and they did get positive results, but a little caveat, they used a product that had Uva Ursi along with dandelion root, which primarily is used as a diuretic to help them pee more. So I would still consider that a positive result, though we just don't know if it was all due to Uva Ursi or the dandelion root. Now let's talk about dosing and side effects. We already talked about the arbutin. In some of the studies, they used a product that had a 20% standardized extract of arbutin, so keep that in mind. I wouldn't recommend it in pregnancy or breastfeeding. Kidney or liver issues, I would be careful with it as well. As far as side effects, primarily what shows up generally is stomach-related side effects. Nothing serious. There weren't a lot of people having to stop the studies because of it. As far as dosing, generally speaking, they were given 400 to 800 milligrams of that arbutin a day in divided doses, usually around 3 times a day. And again, we're looking for a standardized extract. I'll include a link in the description to some of these products. I'll also include a link to the studies that I'm talking about here if you want to go check those out for whatever reason. Another little caveat with dosing, it appears to be, if it's going to be helpful, it appears to be more helpful if you start it immediately as soon as you have symptoms. If you have recurrent UTIs and you try to start it 2 days later, I think you're wasting your time. So that brings up a good point. Do I think it's a good option for UTIs? I think it's a decent option. I do think, based off what I've seen, I think there's more effective options. I've done another UTI video as far as natural therapies. I do think Uva Ursi is maybe worth a shot. You definitely want to start it as soon as possible. If you've waited a couple days, I wouldn't mess around with it. But if it's something, UTIs just come on and you want to try it, go ahead. It does appear to have positive results. I don't think it's quite on par with antibiotics per se, but it's probably a decent option to consider if antibiotics aren't an option for you. And what I mean by that is if you happen to have some in your house, you want to order a supplement to have just in case, maybe worth trying for a day or two. I don't think it's a cure-all by any means, but it's a decent option. What I would like, let me know in the comments, you guys, if you've tried this. Did you get good results? Because I'm primarily going off studies here. This is one of them that I actually haven't had a lot of feedback from people in the real world if it's actually helped them. So please let me know in the comments if it has. I'd love to be able to give it a more kind of robust recommendation. Yeah, that would be helpful. So speaking of which, I hope this video was helpful, guys. I'll see you in the next one. Thank you.